We are so happy to be welcoming Ariel, who is our culinary instructor, is also the founder of Fair Meals, and is a registered dietitian and is all things food related.
Thank you, Frances. So actually today I'm really going to focus on diabetes. Diabetes is a pretty large topic. There's really a lot to talk about, especially as it pertains to nutrition. So I really think it's important to give it, the time it deserves. And I think my role here is really to explain to everybody and to really educate everybody and let people know that nutrition does play a very big role in a lot of these comorbidities. And these comorbidities, I mean, meaning diabetes, hypertension, and so many other ones. So, there may not be, direct prevention, but a lot of the times there is, a lot of indirect prevention and a lot of things we can do in terms of management of these conditions when it comes to nutrition. So what is diabetes? So diabetes is a chronic meaning long lasting, right? Disease that affects how the body turns food into energy. So there are three main types. There's type 1 diabetes, and we'll talk about the difference between the three types. So there's type 1 diabetes, there's type 2 diabetes, and there's gestational diabetes. So did you know that? So kidney disease, so diabetes is the #1 cause of kidney failure in the US, right? So of course, if one has diabetes and it's managed properly by nutrition, insulin therapy, medication, that can 100% prevent kidney disease. But sometimes when diabetes gets totally out of control and we have very long periods of our blood sugars out of whack and really, really high numbers, it really can in fact lead to kidney disease, mortality. Obviously, diabetes is the 7th leading cause of death in the United States and prevalent. So more than 37 million adult Americans have diabetes, and the number of adults diagnosed with diabetes has more than doubled in the past 20 years. And the reason for that is, I think there's like a magnitude of reasons. There's so many reasons, but I think a lot of it has to do, especially, type 2 diabetes really just has to do with the American diet, right? Like there's really is a large correlation between, obesity and diabetes. And a lot of that has to do with just foods that we're eating and foods that are, the fast food options that are available and all of that. So I think it's a really, it can be a pretty daunting statistic, but I think it's a really important statistic to know and to understand. And I really want to reiterate this again, because it is there, unfortunately, there really is a lot of prevalence of diabetes. Most people can live a really, really healthy, long life with diabetes as long as it's managed properly. All of these, I would say like side effects almost are really just people who kind of let it slide and have long unmanaged diabetes. So management of diabetes is super, super important. And that's like really just the #1 thing that I wanted to, let everybody know. So the basics. So our body breaks down food into glucose. So glucose is essentially another word for sugar. So that's released into the bloodstream, right? So if you may have heard the term blood glucose, that's essentially just saying blood sugar. It's the same exact thing. They're synonyms of each other. Glucose in the bloodstream increases blood sugar levels, right? So if anybody has diabetes and they check their blood sugars with like a little stick, or if they have the glucose monitor, that's the continuous glucose monitor that they can check on their phones or some other type of, machine, that they are checking that blood sugar that's in your blood that's coming from the food that we're eating. So when this happens, the pancreas releases the hormone insulin. With the help of insulin, our body can use the energy we get from the food by allowing glucose into our cells. And this decreases blood sugar levels. So that's if our insulin is working properly. If the pancreas is releasing insulin properly and all of this is working properly, then this is like a beautiful system. Then this works really well. We take this energy, we bring it into our cells, and this decreases our blood sugar level. And that is exactly what we want to happen. Diabetes is developed when insulin is not produced. So that's type 1 diabetes, or it's not doing its job properly, and that's type 2 diabetes. So again, type 1 diabetes is when insulin's not produced, right? The pancreas is not producing the insulin. And type 2 diabetes is when it's not taking that blood sugar and bringing it to our cells, but in fact, it's just not doing its job properly at all. And we call this insulin resistance. Our bodies are resistant to the insulin doing its job. So when blood sugar levels are too high, there are dangerous long-term complications that we mentioned. So now I'm going to just talk a little bit about the difference between those three types of diabetes, right? Type 1, type 2, and gestational. And gestational we'll go through pretty quickly, but type 1 and type 2 are definitely the most common and the most, I think, important for today's lecture. So type 1 diabetes is an autoimmune disorder. So autoimmune essentially means like the body is attacking itself by mistake, right? It's I think that's the simplest way of saying this. Our body it's recognizing something as like a foreign substance, let's say, or something foreign, so it's attacking it. So that's what an autoimmune disorder is. And there's so many different types of autoimmune disorders. Type 1 diabetes is just another example of them. So in this case, the body, it does not produce insulin at all, right? The pancreas does not produce insulin. So individuals with type 1 diabetes, they have to take insulin every day, right? They can't have, with type 2 diabetes, which we'll talk about in a minute, there are different options. We can do medication. A lot of the times we can even control it, just with our diet itself, depending on how high our blood sugar levels are. But with type 1 diabetes, because insulin is not being produced, insulin must be entered into the body every day from this external source. So about 5 to 10% of people with diabetes have this type, and it's common to be diagnosed while they're young. So they call this also like juvenile diabetes, right? That's like a nickname for type 1 diabetes. It's not necessary. It doesn't necessarily mean that, as we get older, we can't be diagnosed with type 1 diabetes, but it's typically found in young children or young adults. It usually comes out, at a younger age, which sometimes can be actually pretty difficult to diagnose because a lot of the times, kids can be really young, and we'll talk about some of the symptoms, but it's really kind of hard to decipher, is this normal? Is this diabetes? And it can get a little bit tricky. So, sometimes actually kids can go, I don't want to say a few months, but they can definitely go a few weeks undiagnosed. And a lot of the times then they end up being hospitalized, even if they don't really have to be, because it actually takes a little bit longer for them to be diagnosed. And so their blood sugars are pretty high, for a few weeks. And that can just cause some acute complications, nothing super chronic, nothing that really can't be dealt with, with proper medical attention, but it's definitely something that can be a little bit more complicated. So now type 2 diabetes. Majority of the diabetes is type 2 diabetes. It's the most common type, and it makes up like that 90 to 95% of diabetes cases. So really, really much more common. So this is the result of insulin resistance. So I mentioned that term before. So cells don't respond normally to insulin. So the pancreas makes even more insulin, but fails to regulate blood sugar, right? So the pancreas is doing the proper job. It's making that insulin, but it's not allowing the blood sugar to enter the cells. It's not allowing it to be converted into energy. So it's almost creating so much insulin, but it's not allowing it to really do its job. It's like tricking us in a way, right? So we have the insulin, it's there, but it's not working properly. So it really usually develops over time. A lot of the time it can be a result of risk factors like lifestyle choices. So diet and exercise are huge lifestyle choices that can affect type 2 diabetes. And we're seeing actually, type 2 diabetes many years back was really diagnosed in older adults. And we're seeing, in pediatric cases, we're seeing so much obesity and morbid obesity in such young ages. We're actually, unfortunately, seeing a lot more type 2 diabetes in pediatric cases as well. Like I said, they used to call type 1 diabetes the juvenile diabetes. Unfortunately, we're seeing a lot of type 2 diabetes as well in this younger generation. So really a lot of that has to do with diet and exercise and these types of lifestyle choices. So then we have gestational diabetes. If anyone's been pregnant before the 3rd trimester, they'll get their blood sugars checked, right? They have to take this like very, very sugary drink. You're essentially drinking like pure sugar, and then you have to wait an hour, and then they're checking your blood sugar. And this happens in women who have never had diabetes before, right? It just develops. This has actually not much to do with diet. It's usually, it's almost a fluke. It's almost like it's pretty random in who this, and how, in which women, develop gestational diabetes. But it can create health problems during pregnancy, but it usually goes away once the baby's born. And it's very, very important that women who do have gestational diabetes, they manage this either with, nutrition, with medication such as metformin or insulin as well. Insulin's pretty rare to use. It's usually medication or dietary management. Having gestational diabetes, even though most of the time does go away, it does increase the risk of developing diabetes after pregnancy. So most people, it goes away after pregnancy, but many years later, they're definitely at an increased risk of developing type 2 diabetes. And a lot of things that we can do is to, still continue to follow healthy lifestyle choices, right? Exercising, diet, and that will hopefully bring down that prevalence of developing diabetes later in life. So here are the common symptoms, right? And I don't want, anyone to feel nervous, like, oh, I feel this, I have diabetes. It's a pretty excessive feeling, right? So feeling very, very thirsty. I remember actually taking my son to the pediatrician, and I was saying like, yeah, he's been drinking a lot and then peeing a lot. And she's like, I'll give you an example of a pediatric case I had, a few months ago. There was a girl who was so thirsty in the middle of the night. She broke her snow globe and drank the water out of the snow globe. That's how thirsty she was. So it's really, really, that was just an example to show it's really, really excessive thirst, right? It's not just, hey, we're thirsty a lot during the day, we want to drink a lot of water. It's feeling very, very thirsty very, very often. Peeing more than usual. And a lot of the times we're drinking a lot of water when we go to the bathroom, and that's okay. But if you're almost outputting more than you're inputting, that's a symptom as well. And feeling very, very hungry. And it's feeling very hungry very much during the day. And a lot of the times, but sometimes feeling hungry is really because we're thirsty, right? So a lot of the times, if you work with, let's say, a dietitian, they'll tell you, well, if you're feeling really hungry at a certain point, you should try to drink some water first and see if that kind of subsides the hunger. So a lot of the times the feeling that hunger is because of how thirsty you are. So it's kind of complicated to know, is our stomach playing a trick on our brain, right? Are we actually really, really thirsty that we feel hungry, or are we actually really hungry? But a lot of people say that it's really because of this excessive thirst that we're feeling. Feeling very tired. It's very, very lethargic, really all day. There's a lot of feeling of being tired, and that's because the blood sugars are so high, and our blood is almost like syrup. So it takes a little bit longer for it to go, through our system, and it just creates us to be a little bit more tired. Slow healing wounds, right? So if we get, like a cut or something and it's bleeding, or it's not even a cut, it's more of a wound. If we get some sort of, let's say, like a wound on our foot and it's taking a really, really long time to heal, that's also a potential symptom. And losing weight without trying. This is definitely a big one, right? A lot of the times there'll be people who are just rapidly losing weight. And this is a sign and a symptom of many illnesses, but definitely included in diabetes as well. So how do we diagnose for diabetes, right? So I'm sure a lot of you, so you see this HbA1c, right? At your doctor's offices, or if you go to a clinic, they probably will call it an A1C, right? You've probably heard that term before. So we test for our A1C, and this is essentially a test to measure our average blood sugar over the past few months, and that helps determine our diabetes risk, right? So it's usually a 3-month average. I worked with somebody a few months ago, and they just had their blood sugars, taken at their clinic. And I looked there and I said, your blood sugar was high, but that isn't really necessarily the best way to determine whether or not, you have diabetes, because your A1C is really the average. So it's the average of how your blood sugars really are generally throughout that 3-month period. So anything they say 5.6 to 5.8, let's say, that's considered pre-diabetes, right? So your doctor will usually flag it and tell you, try to maybe lose some weight, maybe try working out a little bit more, more physical activity, or, eating a little bit healthier, less, simple carbohydrates, things like that. They'll try to talk to you on how to kind of manage that, right? They're not going to yet put you probably on a medication or an insulin. They'll likely have you try to manage it with these lifestyle factors and these lifestyle choices. So as I mentioned, these A1C levels. So it says here 5.7. Already at 5.6, a lot of the times doctors will tell you will flag it. Ideally, they should be below 5.7. So it says 5.7 to 6.4. 6.4 is technically more than prediabetes, but sometimes, it really depends on some other factors. Like if your blood sugars that day are a little bit lower, then they'll likely say that's more prediabetes. But 6.4 is definitely on the higher end, and likely your doctor will have you come in to repeat those blood levels again. So 6.4 and higher, that's when that's like the official diabetes diagnosis. That's when, they'll either send you to an endocrinologist, or if your doctor, specializes in endocrinology, they'll be able to kind of talk to you through the options of what management will look like. So what are some long-term complications? And again, this is all, I'm going to reiterate this 100 times. This is all, complications if a management is unsuccessful. So there can be memory loss, heart disease. Heart disease is a huge complication of diabetes, nerve damage, vision loss, kidney disease, and foot problems, right? So a lot of the times when we say foot problems, most of the time it's getting sores or wounds or ulcers on our feet that are very, very difficult to heal on their own. And unfortunately, sometimes it can lead to, needing amputation because it can then cause nerve damage. And there's really, unfortunately, a lot of complications that come with, diabetes that's not managed properly. What are some of the things that we can do to prevent and then to manage, right? So prevention. So physical activity. Physical activity is so, so important. It can really, really help lower A1C, by a point or two. It's really, really, it's a very, very significant thing, and it's a very important thing. And I'm not saying, we have to do 5 days a week, very intense, types of physical activity, but even walking, right? Going for walks, doing even chair exercises, weight bearing exercise, any sort of physical activity where we're really just like moving our body in any way is really, really important. And then obviously proper nutrition, right? Making sure we're not consuming too many simple carbohydrates as opposed to complex carbohydrates. Simple carbohydrates are things like white bread, things made with white sugar, cookies, candy, cake, cupcakes, those types of things. And then complex carbohydrates are things that have fiber in them, right? So there's brown rice, whole wheat pasta, whole wheat bread, whole grain bread, fruits, right? Fruit, yogurt, these are all complex carbohydrates. Actually yogurt does not have fiber in it, but it has other nutrients, and it is considered a carbohydrate and a more of a complex carbohydrate. But, fruit, some starchy vegetables, those are all considered to be, complex carbohydrates. And when people, do have type 1 or type 2 diabetes, it is important that we consume fiber. Fiber is a very, very important thing. Carbohydrates. Carbohydrates are very important. When we talk about, I don't want to use the term meal planning because I think that's not the right term for it. But when we do, look at, how our meals should be planned, every meal should actually contain a large amount of carbohydrates, but we want to make sure those are complex carbohydrates. We want to make sure they're fruits, they're starchy vegetables, they're whole grains, things like that. So management, like prescribed medication. So there's things like metformin, which is a very, very popular medication that's used for diabetes management, type 2 diabetes management, and insulin therapy. And insulin therapy is something that's definitely used in type 1 diabetes, but can be used as well in type 2 diabetes. So glycemic index. So this can get a little bit complicated. So I kind of, I put this chart here because I think it's a really good visual to kind of explain to you what glycemic index is. So the glycemic index is a value of how 100 assigned foods based on how they affect blood sugar levels. So when we eat a certain food, how exactly is that going to affect our blood sugar? So it can be used as a tool in type 2 diabetes management to make healthy choices that support stable blood sugar. So when somebody who has type 2 diabetes, or let's say gestational diabetes, and they choose dietary management as opposed to taking medication, this is a very, very important tool. And, in the beginning, nowadays there's apps, you can look on Google, but there's apps of saying like, oh, well, how is this going to affect my blood sugar, right? What is the proper portion size I should have on, how this type of food is going to affect my blood sugar, that's very, very helpful in the management of those types of diabetes. So for example, things that have high glycemic index, we'll look here where it's red and pink, right? So things like white bread, hamburgers, because really of the bun, cake, beer, ice cream, even really corn, regular potatoes. Sweet potatoes have a little bit of a lower one, but corn and jelly, things like that. Those are things that actually will affect our blood sugar relatively quickly. And it doesn't mean we can't, ever have them. It just means that we have to be cognizant that when we eat that, our blood sugar will spike pretty high pretty quickly. So, some of these foods are healthy, right? Like potatoes and corn, and you see squash, right? That's like a starchy vegetable also. Those are things that they will, affect our blood sugar more quickly. It's just important that we know that ahead of time. Things that are medium glycemic index, a pear, an orange, pineapple, kiwi, banana, berries. Those are things that are medium. They won't affect our blood sugar as quickly, and there won't be as high of a spike as fast, but they definitely still have an effect. And low glycemic index foods are definitely our best friend, right? I know plenty of friends who've had, let's say, gestational diabetes, and they'll always say, oh, cheese is their best friend during pregnancy. And, patients or people who have type 2 diabetes, for example, cheese is their best friend, right? It's a really, really great snack for them. It's great for them to have in meals also because it's a very low glycemic food. So cheese, fish, right? Cucumbers, let's say mushrooms, strawberries, apples, lettuce. These are all things that are really not affecting our glycemic index much at all. It's not, causing any quick shift or quick rise rather. This is not a very extensive chart. There's obviously more extensive charts for people who are looking to manage it, with dietary and nutrition. So definitely, look into apps and look on Google, and there's things that are very, very helpful. So high GI foods, as we mentioned, to spike blood sugar, high. It includes bread, oatmeal, pasta, potatoes, baked goods, watermelon. This is pretty much what it is, right? So we have the high, medium, and low.
Is fresh fruit better than juice or canned when it comes to glycemic index?
When we juice even if we're making fresh squeezed juice, we're taking out all of the good stuff. We're taking out the pulp, that's where the fiber is, right? The pulp, the pith, all of that is where the fiber actually is. And that's going to help lower our glycemic index. That's going to help prevent that spike. So when we have things that are high in fiber, that's going to, that will prevent that spike from going up really, really high. A lot of people in the summer think that watermelon is a great hydrating fruit, but watermelon is one of the highest glycemic index. I'm not going to say foods, but definitely fruits. It really affects our blood sugar pretty quickly. And, if I'm working with clients who do have diabetes, I'll usually tell them a cucumber is a much better option for them, as this hydrating vegetable, because cucumbers are very, very high in water and have a very, very low glycemic index. Whereas watermelon, we can't eat unlimited amounts, and nobody should. Even if somebody doesn't have a high A1C and they're, is not diagnosed with diabetes, it still will affect their blood sugars. And sugar, by the way, even in fruit's obviously going to be a better option than a cupcake, but sugar is sugar. It will be processed in our body as sugar, whether we're eating a piece of watermelon or we're eating a cupcake. Sugar is sugar. And I think that that's like a really important thing to explain. And so that's a really important thing to, to also note, just, when we are thinking about our blood sugars, that, these foods will in fact impact those blood sugars. So that's, the watermelon example is definitely something I really like to explain and to tell people, especially who are diagnosed with diabetes, just because we don't want to eat too much. We don't want to eat unlimited amounts of really any fruit, but really watermelon, that's like the number one fruit. When I think of glycemic index, I think of watermelon, high glycemic index. We want to have oatmeal for breakfast. That's great. Let's pair that with some, let's say with eggs, something that really is a completely low glycemic index food. Pair it with something that's going to, something that's not a carbohydrate, but definitely oatmeal, whole grain, that type of stuff they're all, great options. It's really important for anybody who is diagnosed with diabetes to always sometimes they make like sugar chews, having apple juice, a box of raisins, something that's very, very high in sugar. And they want it to be at least 15 grams. So one carbohydrate is 15 grams of carbohydrate. That's kind of how we calculate that. I don't know if that makes sense to everybody, but just keep that 15 grams of carbohydrate is one carbohydrate. That's how much we want to then take. If our blood sugar goes too low and we're feeling really dizzy and we're feeling really out of it, we do want to make sure that we're bringing up our blood sugar enough. So we want it to be, we don't really want it to be more than 30 grams of carbohydrates, but it should be about 15 to 30 grams of carbohydrates so that our blood sugar does go up enough. But we want it to be something that is, pretty purely sugar almost in a way to help, to make sure that we don't, because hypoglycemia, so it's hyperglycemia is when our blood sugars are too high and hypo is when they're too low. There is a ton of complications that come with that as well. And we want to prevent them from getting too low as well. So not eating, for example, that can cause hypoglycemia, that can cause our blood sugars to get too low. So it's and not eating any carbohydrates, by the way, can do that. So we really do want to make sure that we are having carbohydrates at every single meal. Snacks, I'm okay. If we want to make sure our snacks have no carbohydrates, that's fine. But every meal, breakfast, lunch, and dinner, there should be carbohydrates in that meal to prevent any sort of major dip in our blood sugars. I call this a hack, but I always tell people, and this should goes for everybody because it can also keep us fuller for longer. If we are having a fruit, let's say, we should pair it with a healthy fat, right? We should pair it or with a healthy fat / protein. So if we're going to have a banana, I'll always tell people, like, let's say for a snack, I'll always tell people put some peanut butter on there, right? Or any sort of nut butter or a seed butter. Same thing with an apple or a pear. If we're having a fruit and we don't want to have let's say the peanut butter, have a cheese stick with that, right? Have some cheese, pair with a protein. And that also will help prevent our blood sugars from spiking too high. The protein helps kind of bring down, or rather, help kind of stabilize our blood sugars and let it have a slower increase rather than a very quick increase. A very old school way of practicing nutrition, calorie counting, carb counting. These are very old school ways. They're not things that we preach now. Keeping in mind how many carbohydrates we're eating at each meal, that's kind of the best way to go about the best type of diet. And I don't want to say it's really a diet, it's more of a lifestyle, right? Of making sure we're getting between 40 to 65 grams of carbohydrates at each meal. And that's, and you can look those up, by the way. There's a ton of apps of how many grams of carbs are in this food and this serving, and they'll tell you what the serving size should be and how much then you're getting. And that's, I would say, the best thing to follow if you are especially somebody who's really trying to manage their diabetes without medication and really through nutrition and diet. Following an app like that, carb counting, things like that are really going to be very, very helpful in a successful management. Our thyroid is very important as in playing a role with our hormones, right? And insulin is a hormone. So having, non-managed thyroid can definitely cause insulin resistance for sure. And vice versa, by the way. A lot of the times uncontrolled diabetes can also cause some thyroid issues as well. So, everything's it's pretty amazing, but really everything in our body is so interconnected, and it's pretty unbelievable.
One thing does lead to another, good and challenging and all others.
There's actually no rhyme or reason. And we see a lot of, mothers or fathers with type 1 diabetes and really don't pass it to any of their children. Grandparents have it, and then we'll see it in grandchildren or in great-grandchildren. So in that sense, we could say, yes, there's some genetics at play, but it's not definite with type 1 that if your mom or your dad has it, that, necessarily they'll pass it on to their children. Type 2 diabetes, yes, it's definitely something that can be genetic, but there's still so much that we can do to help prevent that. So genetics is definitely at play, but it doesn't necessarily mean that it's 100%.
And so all of these sort of diet and exercise strategies, I mean, they're good for everybody anyway,
Yes.
but those could be, good tools for somebody who knows that diabetes runs in their family, but isn't necessarily pre-diabetic.
For sure. And also really because obesity and diet really plays a large role in the onset of diabetes, type 2 diabetes. So really, very important.
With like a good diet and with exercise, can you stop having diabetes?
Not with type 1 diabetes, but with type 2
Mhm.
diabetes, 100%. And I've
Mhm.
seen it happen. And there's really no better feeling to those individuals who do that and who work really hard with that. Definitely, there have been a lot of people who, have type 2 diabetes or pre-diabetic, and they've worked really hard, with physical activity and diet, and have, really come out of having diabetes. So
That's
it's
great.
pretty great. You can live an extremely long, healthy, beautiful life with both type 1 and type 2 diabetes as long as we manage it properly.